Hello, and welcome to the Health Education Program, Children with Asthma. The population at risk that we will be discussing today is the pediatric patient with a diagnosis of asthma. First, let me begin by introducing myself. My name is Daisy Behnke, and I am a BSN student at Indiana State University. Today, we will be discussing asthma in the pediatric patient. We'll be discussing what an acute asthmatic attack looks like, how to treat such of an asthmatic attack, and when the patient and the family should seek help. We also will discuss some home interventions that the family can take to help minimize those acute asthmatic attacks for the child. Objectives of learning include being able to recognize the signs of an acute attack, be able to cite interventions to treat an acute attack, recognizing common triggers for an acute attack, and be able to recognize the emergent symptoms and when to call 911. Also, you should be able to name at least 3 preventative strategies to reduce the risk of having an acute asthmatic attack. But before we begin the video, I would like you all to go ahead and pause this video now so that you can take the pretest. You'll find the link for the pretest below in the description of the video. Again, go ahead and just pause the video now, go to the description below and click the link for the pretest. And when you're finished, go ahead and join us back and press play once again. Hello, welcome back. So let's start by talking about what is asthma exactly. Asthma is a disease that impacts the lungs. According to the CDC, 11.2% of all children in the state of Oregon have asthma, and 7 million children nationwide carry the same diagnosis. The CDC characterizes asthma as having frequent episodes of coughing, wheezing, shortness of breath, chest tightness, and/or chest pain. Now, the child may have all of these symptoms or may only present with a few. But either way, it's important to pay attention in case your child may have this diagnosis. To talk a little bit about statistics, it is important to note that the females have a higher national prevalence. Also, African Americans have a higher prevalence, followed by whites and then by Hispanics, all according to the Center for Disease Control and Prevention. Asthma also seems to be most prevalent with people who live in poverty limits and who live in the West and in the South. According to the EPA, asthma accounts for 2 million emergency departments each year. Also, according to the CDC, 1 in every 12 children have asthma in the United States. Americans spend about 90% of their time indoors, so it's important to control those triggers, and we'll discuss more about that later. And also, according to the EPA, a reported 13.8 million school days were missed in 2013 alone due to an asthma-related illnesses. So it's safe to say the prevalence of asthma in the pediatric patient is important to try to manage those symptoms so that these children do not miss any more school. So let's talk about those triggers. What are some common triggers? Well, those indoor triggers include tobacco, such as secondhand smoke, dust mites, mold, cockroaches and pests, and outdoor, the main trigger would be air pollution. So it's important to check your local news stations, your local radio stations, internet sites, to check on the air quality outside on a daily basis. And then what you'll want to do is to plan all your outdoor activities when the air quality outside is better. Stay indoors when the air quality is poor. Dust mites are very small. They are naked to the eye. They live on everything, including mattresses and toys, carpet, furniture, and much more within the home. You'll want to make sure to wash blankets and linen at least weekly with hot water. Make sure to wash all washable stuffed toys and to use allergen impermeable dust-proof covers for mattresses and pillows. Mold can also be hard to get rid of. It's important to remember, though, that mold grows on things that are moist. So make sure to get rid of any excess moisture in the home. And if you have mold in the home, go ahead and look up a solution to clean the mold yourself, or you can hire a professional to clean it up. Either way, it's important to make sure to eliminate any mold in the home, as it can be a significant trigger for folks with asthma. A fun children's activities book from the EPA is listed here to learn more about asthma triggers. This book is geared towards children, so they will have fun learning, and you can access the link again below in the description of this video. Go ahead and pause and then click on the link below if you'd like, or you can come back to it later. We've also added a few sites to check out the air quality in your area. One is from the EPA, and the other one is from www.airnow.gov. Again, I've went ahead and listed these links in the description of the video below. You can pause the video here and go and click on the links below, or if you'd like, again, you can come back later. It is also important when you speak to the doctor to talk about obtaining an asthma action plan. Now, these plans can be simple, it can be developed with your doctor, and what they do is they let the caregiver or the school nurse or the babysitter or just anybody that is in care of your child know what to do when an asthma attack arrives, what medications to give them, and what sort of triggers to keep the patient away from. Now here I've listed a sample action plan, but when you discuss it with your doctor, you guys can decide on one that fits your needs. Some other things the child can do is exercise. Now you'll want to make sure that when they do the exercises, that they do it very carefully. First, you'll want to start by having them go slowly. Make sure they either bring a friend or you're there to watch them for safety. Make sure that they take breaks when needed, often making frequent stops, and make sure that they know what their triggers are and make sure that they stay away from them. And also, if you're going to exercise outside, make sure to only do so when the air quality is good. So after watching this video, do you have a suspicion that your child has asthma? Make sure to call your doctor right away and get in for an evaluation. Early diagnosis is crucial, and symptom management can be very beneficial for your child. I have included a complimentary brochure with all the information presented in this video. It is available to print as a PDF form, and the link is below, provided in the video description below. So again, you may pause this video now and go ahead and click on the link, or you may come back to it later. So before you move on to take the post test, I thought it'd be fun to do a little rap session on asthma. So here I go. My name is Daisy, and I'm here to say I want to control your asthma every day. Wheezing, shortness of breath, and chest pain. Listen up, don't let my words be in vain. Asthma, asthma, asthma attack. How do you keep it from coming back? Puff, puff, up in smoke. It's time to quit, that ain't no joke. Remove the dust and clean your home. Don't let the cockroaches roam. Make a plan, talk to your MD, take your RX daily. Your asthma will be controlled, just wait and see. So we've come to the conclusion of this learning module. Please go ahead and take this time to pause the video, click on the link below in the description of the video for the post test. Let's see what you have learned.